congratulations. Your county is part of our latest system of care grant for the state. And of course, Delaware County has been involved with systems of care for many years now, so this is not necessarily new information to some of you, but I'm not sure how familiar, Tiffany and Desiree, you guys are with systems of care through the TIP program. So I'm just going to do like a tiny little bit of background information, and I'll just talk through what the evaluation part is all about and what your teams and your staff will be doing and what we'll be doing and all that kind of stuff. So I sent out the PowerPoints and some of the tools, the forms that we used yesterday. So hopefully you guys all got those. And I'm just going to walk. What was that? Did you say yes?
Yes.
You got everything? Okay, perfect. All right, so as I walk through this stuff, don't hesitate at all to, interrupt or check in. And there's definitely parts where we have to kind of figure out together how this is going to work and what the best way is as far as how your process goes. There'll be a lot of things where we just talk about, what's the right timing for some of this stuff to happen, and how can we partner to sort of make it go as smoothly as possible. So that part, will be definitely interactive. But just as I go through some of this other stuff, please feel free to jump in and ask any questions at all. And then I think when Mark joins, we'll pause and, let him introduce himself and just talk through anything that he may have wanted to mention. So, okay. So let's get started. Just sort of real brief, systems of care. I guess I should just ask you, Tiffany and Desiree, do you have any sort of background in systems of care at all from your program or from what you sort of know about the county?
We've attended, the meetings and just information that Dan has shared.
Okay, all right, good. So you have like some background, and I guess this is a little bit of a refresher. Systems of care is really sort of a philosophy about how we work with families and youth, and how to kind of build a system together that makes sense, where it's a network. It has lots of effective community-based services and supports. Systems of care is typically for the youth who are sort of most at risk for out-of-home placement. They certainly have a mental health concern, and then typically there are quite a few other challenges around other systems involved or other trauma or, family concerns that kind of, make the picture a little bit more complex. So systems of care is really designed to kind of figure out what's the best system that we could have in place where we can have a coordinated network, culturally and linguistically competent services and supports, and then meaningful partnership with families and youth. And like I said, Delaware has already done quite a bit in those areas to sort of bring people together and start to have all those conversations and, design services and supports that are really thoughtful and in partnership with families and youth. And then the last line there is really about the reason why we do all this is because we want to help families function better and have a better experience and better life at home and school and the community and throughout their lives. So I think of that last line as the outcomes of system of care. And so those are really, it's those like functional outcomes that we are tasked to try to evaluate whenever counties and states join system of care grants. So system of care is funded through SAMHSA, which is the Substance Abuse and Mental Health Services Administration. That's a federal funder. And they give billions and billions of dollars out to communities across the country and in all of the territories that are related to the United States in a variety, in like mental health and in substance use, for all kind of ages of the lifespan. They target grants for all kinds of different purposes, but they all kind of have that philosophy of, community-based programming and equal partnership with families and youth and that kind of stuff. So the system of care grants have been coming out since, the early 90s. So these have been around for a really long time. And like I mentioned, Pennsylvania has had quite a few of these, both at the state level and in the different community partnerships. So like Philadelphia region, not that far from you, has its own system of care grant. Many other counties like Luzerne and Erie and some rural counties in the middle of the state, and out in Pittsburgh where I live, and there are lots of little system of care grants, but they all kind of go with this philosophy about how we should, better serve children and their families and young adults. So in this particular grant, and I'll say this grant is about 2 years old, so it was a 2017 project that got awarded to the state, and there are 6 other counties, 6 or 7. Let me see if I can, 1, 2, 3, 4, 5, 6. Yeah, 6 other counties, so Delaware would be 7 counties total that are partners. No, I lied, 8. I forgot one. So there's 8 other counties that are partners in this project. And so it was designed to kind of expand itself each year. So the first 2 counties that joined right when it started in 2017 were Crawford County, which is like north of Pittsburgh, and York County, which is not that far from you guys. So those were the first 2, and then it was designed to add new counties each year for a total of 4 years, and to kind of create a community where all of the counties, in addition to all those other counties I mentioned around the state that also are doing systems of care, it's sort of creating like a community where you all can share lessons learned and kind of enhance your programming together, as with the funds that are available through this federal agency. So the grant, Delaware is joining right now. They're, like I mentioned, a little over 2 years. The grant ends at the end of September of 2021. So 2 years and a couple of months left. And of course, when SAMHSA gives out lots of money, there are requirements. And for SAMHSA, the evaluation requirements tend to be the ones that are their most significant and the most important to them. So this is what the evaluation looks like, and we're going to go through this in detail, but there are some system level things that have to be collected and reported. And Mark Durgan, who, like I mentioned, will join us, he's going to mostly work with Shannon and other staff at the county to collect that kind of information, but that's the system level information that they're interested in. And for this particular grant, it's things like the number of policy changes that are completed as a result of the grant, things where, you change something about the way that you all serve youth and families, or the way you do business, because of the philosophy of system of care. So that's one of the things. They want to see how many people in the mental health or other related workforces were trained in mental health practices or activities, and those can be all kinds of different things. So that's something that you'll track. And this, again, like I mentioned, Shannon will mostly be tracking this kind of stuff, but she might be partnering with all of you together. They want to know how many consumers or family members provide mental health services as a result of the grant. And then they're interested in the partnerships that organizations enter into to improve mental health practices and activities. So those are like MOUs, or like memorandums of understanding or agreement, where agencies or parts of the system partner together and kind of create a pact to work on things together. So those are the kinds of system level things that are being collected to try to see how the funds that are given out make a difference. And then the thing that I'm really here to talk about most specifically are the youth and family services level data. So when counties join system of care grants, they have to identify services or supportive services or planning processes where they feel that you can see the outcomes of system of care in the best way. So the services data are collected to try to see, as a result of all the things that happen at the county level, and there are lots of things that can happen. There are trainings that, you can do. There are mental health awareness activities. There's all kinds of things that can be done with the budget that you receive from the grant. But what they really want to make sure is that because of all that money and because of that improvement to the system, that families and youth in their homes and in the places they live and work and play and everything else, that they're getting better, that they're making improvements in a lot of different areas. So the thing that we do is we collect information about that. So we collect information about who they are, and that's the sort of descriptive demographic information. So there's whole bunches of demographics and kind of who are these youth and families, where are your referrals coming from, What systems are they involved in? Who are they? What are their challenges? What are their strengths? That kind of stuff. And then there's an interview portion that really works its way through a series of questions in quite a few domains around functioning and outcomes. And I'll show you a little bit more about what that is. And then there are some research instruments that they fill out, and they can fill those out on their own. The caregiver fills out a couple of things, and the youth would fill out some things. And so they take all of that data together, and one of the things we do is we provide data dashboards. So dashboards, which I know Dan is familiar with because we provide them in other programs that he's involved with. But these are real-time areas where you all will have access to the data that we collect. So even though we're doing the bulk of the work here, and that's what Ed's going to be talking about a little bit later, we're helping partner with you to collect information on the families and youth that you serve, but we're also giving you access to that information so you can use it for your own programming. Any questions so far? Is everybody still with me, or anything about like the sort of big picture of system of care or kind of what we're doing?
No, sounds good.
Okay. Thanks, Dan. Okay, so I sort of talked about this already, but SAMHSA, when they give out the money, they have to have some concrete data coming back to them about how people use the money and whether or not it was, used to improve those experiences that families and youth have. So this is really a challenge to, turn all of this data into something that is, useful to SAMHSA. And so they give us a very structured interview. One of the things, usually when we look through the interview, and I can give you guys all a copy of the interview if you'd like to see the exact questions that Ed's going to be asking. We're happy to send that out after the webinar today. But you'll see, there might be some questions in there that you kind of wish were worded differently, or that, things that they missed that you'd like to add, or any of those sort of things. And I know we all kind of feel that way at times, but this is really their way of standardizing each community, because every single community that joins system of care might be doing something that looks really different than other communities that are doing systems of care. Some may focus on, trauma, or building a new service, or all kinds of different things. But ultimately, everybody's asked to collect the same data. And they really use this, to prove that this money is making a difference in the world, so that we can continue having it be in the federal budget, and we can continue receiving grants to do this kind of programming. So I mentioned we've done quite a few systems of care grants, and we've learned a few lessons over the years. This is about 7 years that I've been part of it. And so for this particular grant, in the past, what we've done sometimes is we've asked you as providers, in the High Fidelity Wraparound program and the TIP program, to collect the data yourselves and send it to us. And, we sort of know that's a tough ask. You guys certainly, I know in High Fidelity Wraparound, and I know actually in TIP as well, like you already collect a good amount of data on your programming, but like I mentioned, SAMHSA wants this specific evaluation collected. So it's not good enough to be like, oh, we collect something similar, or, oh yeah, we ask something that's like that too. Unfortunately, because of the need to standardize this across all of the different states and territories, it has to be these exact questions and in this exact format. So I know that it's a lot to ask for you all to have your staff collect all that information. So that's what we've done differently in this grant. We are running the entire evaluation through the University of Pittsburgh, and that's where I'm from. We have it approved with our IRB, which is our institutional review board for research. And so Ed has gone through very extensive training, and there's all kinds of stuff that you have to complete when you're operating on behalf of the University of Pittsburgh. So he's got all of that training, and we all do here completed. And Ed also, similar to me, it's about 6.5 years he's been doing these interviews. So quite a bit of experience, but we're going to take on most of the work around collecting the data. And as part of our team, this is sort of some of the rest of our team. There's actually some of us that aren't even on here, but I just put all these names on here just so that you have a record of who we are, because even though I'm doing this training, the person that you'll probably communicate most often with, 2 people, are also on this call. So Anna Maria and Ed. You'll see Anna Maria there is, like I mentioned, doing our research coordination, meaning she's going to be communicating if there's missing information, or if we can't find somebody, and I'll talk a little bit later about there's a very small amount of information that you all have to help us collect, and she'll be kind of coordinating that. And then Ed down there next to the last is doing the interviews, and he not only does them in Delaware County, but he also interviews in Carbon, Monroe, Pike, and York counties, and actually also in Luzerne County for a different project. So he travels around quite a bit, but he's still really good at being flexible with time, and making sure that families, that he can come out and meet with them at a time that's convenient for them. But we have lots of other interviewers and data entry staff and systems analysts that create the dashboards that I'm going to show you. So there's quite a few of us. So if you ever have any questions or need anything, there's certainly a number of people here that can help you. Whoops. The wrong way. Okay, so this is our job, and we're contracted from the grant, from the state, to provide this training, to do the interviews, to do the data entry, and then provide you back the dashboards that I'm going to show you. We do all the data entry into not only our database, but up to SAMHSA, so that they have everything that they need. And then we're here for any kind of questions that you might have about the data, or about how to use it, or just data collection or evaluation in general. We're happy to help if you have any other questions. Okay, I'll check in again. Any questions so far? And then now we're gonna start digging into like the exact requirements of what we need to do here. But anything else in the big picture?
No, we're good.
Okay. Okay, so this evaluation is for youth and young adults who are between the ages of 5 and 21 when they enroll in the project. So they can become older once they're already enrolled, but their very first interview has to be collected when they are up to age 21. The youth themselves only participate in the evaluation when they are 11 years old and older. So if they are between 5 and 11, it's a caregiver only interview that is conducted. And so a caregiver is asked to participate in the interview if the youth is between 5 and 18 years old. But when the youth turns 18, it's sort of up to them. It really is optional depending on their circumstances. If there is an appropriate caregiver who would be able to provide some perspective, if they still live at home with a caregiver, then that's perfectly reasonable. If they live independently or they don't want a parent to participate, then they can choose not to once it gets to age 18. But there's some flexibility in this, meaning like youth can participate alone. Like if a caregiver, let's say a youth who's over age 11 wants to do the interview, but the parent doesn't really want to do their part. The youth could still do it if the parent would sign the consent form and let them do it. And then similarly, a caregiver can do the interview alone, even when the youth is over age 11, if the youth is not interested in participating. So there's a lot of flexibility. So if you have a situation where one of your families says, I don't know, one of us would do it, but not the other, it can still be a referral to us. The youth have to have a mental health diagnosis to be involved in this project, but then they should also have other system involvement, but that's a should, not a necessary. So typically in your programs, it probably is a similar case where when I say system involvement, there might be like an IEP or some special education or an alternative education placement, or something involved with child welfare, juvenile justice, drug and alcohol, any intellectual disabilities, any of those other systems are applicable as well. But the only thing that is a definite must-have is the mental health diagnosis. And then because this whole project runs through the University of Pittsburgh, we're subject to the rules around research in Pennsylvania. So we have to have a biological or adoptive parent or a legal guardian that has permanent legal custody. So they have to have a court order that says they are fully legally responsible for all decisions around that youth in order to participate. So if the youth is in the custody of child welfare, meaning like a caseworker would need to sign consent, they are not eligible to participate in this project. And foster parents can't sign the consent form to participate. It has to be biological or adoptive parent or somebody who has an absolute permanent legal custody arrangement. This is usually kind of confusing, or people have questions? Any questions about this whole part of who's eligible?
No.
And you guys are good. Okay. You're with me. Okay, so this is the process. We ask you guys to speak with any youth and caregivers from not only from this moment on that you're enrolled, but if you have somebody who kind of recently started one of your programs and is still really new, and I'll talk more about that with you in a minute. But so as long as they're very new to the program, we'd ask you to speak to them about this whole process and see if they're interested in at least hearing more about it. And if they are, then you would fill out a permission to contact form, which I sent to you, and I'll show you. We'll go over it in a second. And you would either fax it or email it to us. And then an interviewer, which in this case is Ed, will contact the family, and he'll go over that whole, the sort of structure of what we're asking them to do. He'll go over the consent form over the phone, and he'll, if they agree to everything, he'll set up a time to come out to their house. Or a phone interview, but that would be rare. So, we'll first try to kind of come out and do the interview in their home or in a community location that's good for them. And that whole process of what Ed will do with the youth and the caregiver, if they can both participate, takes about an hour of their time. So that's the process. And I'll get to it in a minute, but they are also compensated for that time. So both the youth and the caregiver get $20 debit cards as a thank you for participating each time he would need to do an interview with them. Okay, does that make sense?
Yeah, that's good. Yeah.
That's good? Okay, good. So this is the permission to contact form. You'll see on there, it's like the name, youth name, caregiver's name, their address, any kind of phone or email that would be good to try to reach them. So that's that information that Ed needs to know about, like where to go and who to call and who to talk to. And then you'll see there that there's a list of mental health diagnoses. So something we've learned over the last couple of years is that it is really challenging. We aren't able to enter the data into the SAMHSA system without the mental health diagnostic information. And more recently, actually, within the last 2 months, they upped the ante on that. It used to be that there just had to be a mental health diagnosis and you can just put that in there. But now they have it set up into this primary, secondary, tertiary kind of format. And you can still say you don't know if you really have no idea which one's the primary diagnosis or whatever. But in all of the training, they're really asking us to try to kind of figure out this information as best we can and to limit the number of times we put don't know in there. And so as a result of that, it's become a real challenge because often families or youth are not aware of the exact diagnostic information. They may know depression or anxiety or behavior or something like that, but they certainly often don't know the codes or for us to characterize that. And because it's so critical to SAMHSA in the information they need from this project, we started putting this is a new thing, on the permission to contact forms and asking you guys if there's a way, like if you have that information, you can give it to us. It's just been, over the last couple of months, so much more successful if we can get that from you rather than Ed trying to kind of figure that out with the family. You might need a release of information to us to release that information that, would be on your own, like, child and family focused release form if that's okay. And I'm also giving you, I already did send, and I'll go back to the form in a second, but this is, not only do they want diagnoses, but they want them in their own format. And they have been very specific with the mental health diagnoses that they're interested in. And so some odd thing that has happened is that they have collapsed a whole bunch of them into like a group. And so we don't need to know specifically like which anxiety disorder or which trauma related disorder. You'll see that group there, F40 to F48, is just a group of diagnoses that relate to anxiety or trauma or stress or dissociation, somatoform. So if they're in that group, all we need to know is that it's in that F40 to 48 grouping. And some of the other ones, if you kind of looked at that form at all, are you know, some are really specific. They're very interested in like really high level psychosis and major depression and lots of interest in substance disorders. If you notice, there are like 3 pages of those. So they're really interested in those things, but then some of the mental health stuff is collapsed. Are you still with me about this? Does this sound like something that you guys collect or that you'd be able to pass on to us in a way that would kind of make this go a little smoother for us? What do you guys think?
We collect this information at intake, so it should be fine for TIP.
Oh, great.
Yeah, this information is part of our referral in Hi-Fi. The release, who should we get the release signed for? Is it System of Care, or is it YFTI, or is it?
It's YFTI. Yeah.
Okay, I already. So that's good.
Okay. Yeah. Perfect. Yep. It's the release would be to us. And Dan, if you have a release that already kind of has that information filled in with it, can you share that with Tiffany and Desiree?
Yeah, I'll email that to Tiff.
Thank you.
That's awesome. Thank you for that. And I'm going to pause here because it looks like Mark joined. So Mark, I just wanted to give you a second to introduce yourself or see if there's anything you wanted to talk about. Actually, he may not be on the phone. It's weird. It says just web for him. So maybe he just double check. Mark, you're not there, are you? On mute or anything? Okay. I don't think he is with us. Okay, so thank you guys for understanding about the diagnostic information. That is fantastic. So another piece that you're going to need to know for that permission to contact form is what is up with that ID number. So in the bottom, let's go back to it. So down here where it says study ID, I'm going to talk to you about that number now. Okay, so the first 3 digits are 295. That's what this grant is designated as in our database. So that's never going to change. It's always the same. And then the next 2 digits are Delaware County, and that's 23 alphabetically. So that's not going to change. So 29523 will always be filled in, and that's why it's pre-filled on your forms. And then the way that we assign numbers beyond that is based on the program, because in the dashboards, we would want to be able to sort out the data from TIP versus high fidelity wraparound into separate categories. And the way for us to do that is to kind of give it a range of ID numbers. So we give you a range of those, 1,000 numbers there. And the best way to do it is just go chronologically and start with, high fidelity wraparound. Your first number would be 0000, and then on to 1, 2, 3, et cetera. And then the TIP program would start with 1,000 and just add that. Now, Dan, I certainly know that you have your high fidelity wraparound ID numbers in your EHR system. And I am curious about whether or not you can, during the course of the grant, while they're being enrolled into this project, they would still be in the high fidelity wraparound data system. But I'm wondering, so it wouldn't affect your other dashboards or anything like that, but I'm wondering what sort of hassle it will be, what would it take to change them for the grant?
For me to, instead of going 166, to turn it to 1295?
Yes.
Or
yeah, exactly.
For anyone who enrolls?
Yes.
That wouldn't, so basically after they consent to do the interviews with Ed, then I would give them a 295 number, or just basically from here till we stop collecting data, switch to 295?
Yeah, it's a great question. And I would recommend that from now until the grant is over, switch everything to 295, because what we've realized in some of the other counties that do hi-fi is that we had this sort of convoluted thing where it's like, oh, it's 166 unless they say yes to Ed, or we'll start with 295, but if they say no to Ed, because they can say no, that's perfectly still okay, for them to not want to do this. But then, well, how do you change them back? You know what I mean? So it became super confusing. So a better way is to just change them from now on, and then, we can go back to 166 when this is over.
Sure. No, that's not.
Okay.
Yeah, I enter all the data anyways.
That's amazing. You just made Will's day. He was sweating about this. Yeah. Now for the TIP, I know, I like when he's happy. It makes my day go easier.
Yeah.
Will's our database manager here, for you guys who don't know him. So Tiffany and Desiree, what is your situation with your numbering, and is this going to be possible?
Well, I would have to consult with our IT person. With ETO, like the numbers are predetermined. It's just like, I think we have our code for our TIP program, but that doesn't correlate with the number assigned to the young person.
Yeah.
So I'll just have to speak with her.
And what you can do, you know, it's a bigger deal for Dan because we manage the data for the high fidelity wraparound program here and also in our database separately from this project. And so it would have been like a huge pain to have like the same person with two different ID numbers all within our system. But for you guys, you know, whether or not you change your ID numbers in your own program, you could always leave those the same and just create like a spreadsheet that has a key for you of like, you know, this particular youth with this ID number now for the grant is a 295231001. You know what I mean?
Right, yeah.
That way you don't have to mess with your system, but you also will know who the people are because, you know, if Anna Maria reaches out to you and says like, oh, we weren't able to contact this person, you know, she likes to communicate by the ID number via email so that we're not, you know, sharing names or anything like that. So as long as you know who those people are and you have a connection, you know, that's perfectly fine.
Okay.
Okay, perfect.
Tiffany, maybe we can come up with some kind of shared tracking spreadsheet that we can do on the J drive or something between our programs, just to keep everybody straight.
Yeah, that sounds good.
Okay, great. Okay, and then the last thing that's sort of important and confusing on the permission to contact form. So we covered, you know, address, phone number, diagnosis, the ID. This last thing is the date of first meeting. This is like probably the most confusing thing that happens, but I'm going to walk you through it and we'll see what makes sense to you. So it's going to be, I think, pretty easy for high fidelity wraparound because we have worked with this program quite a few times. So I'm going to use that as an example, and then we'll see how this might line up with TIP for you. So what typically happens is, you know, a youth and their family enrolls in high fidelity wraparound, and that's their enrollment date into that program when they agree to the process and they sign all those consent forms, and then they go into what high fidelity wraparound calls an engagement phase. And during that time, the team is meeting with the family and learning all about them and their culture and their needs and strengths and all that kind of stuff. And they're working with them over a period of time, you know, like around 30 days or so. And during that time, we don't necessarily want to interfere with that engagement with this evaluation. So we say to you guys, you know, you just do, you know, whatever you're doing to kind of get them all oriented to figure out until you move into the planning phase, you know, where you kind of are ready to start the process. For high fidelity wraparound, there's a first team planning meeting that occurs. And when that meeting happens, they switch from the engagement phase to the planning phase. And what we ask you guys to put on this form for us is the date that meeting happens. And we ask you to, I mean, you can tell families or youth that this evaluation is happening. You might want to tell them earlier on in the process, like, you know, once we get familiar with each other, we're going to ask you if you'd be willing to participate in this other, you know, research study kind of thing where you're going to get a thank you payment for it, and it's, you know, kind of separate than our program. We just don't want them to be confused or put off by, you know, too much data collection in that early part of the process. So we are allowing you to think of, you know, to come up with a date that is flexible, that's considered their enrollment into system of care. And it is not their enrollment into your program, if that's making sense to you. And so what happens is when we get the date on this form, that's now considered their enrollment date into system of care. And Ed has to complete that first interview with them within 30 days of the date that's on this form. So it's really important to, you know, make sure that you've introduced this idea to them right around that date and ask them if they'd be willing to do it and fill out the permission form and send it to us, because he needs as much time as possible to contact the family and set up the date, you know, to come out and meet them. And so it's just important. The timing of all this is really critical, because if you ask them about this too soon and have them kind of fill out the form like when you're doing your intake paperwork, but then you write the date on it later, they may have forgotten all about Ed and this form and everything else. So it's like way out of their minds at that point. So we really want you to try to maybe mention it sooner, but fill out this form with them and put the date on there, and send it to us as soon as possible after that date, so that we have the best chance of it being fresh in their minds when Ed calls them, and then we have the most time within our 30-day window to fill this, to get everything completed. So does that make sense? And then, it's real simple in high fidelity wraparound, like, because there's like an actual team meeting that happens, and that's real simple to figure out what that date should be on this form. But how does that align with TIP? Do you have like an engagement phase? How does it work for you in the early stages of working with a family?
Well, we have to complete their individual service plan within 30 days. So we could have that as a part of that process, just added to our checklist. At the first 30-day period, they'll complete this form. We'll inform them of the program and move forward. But we're checking off those things anyway.
Okay, that sounds great. That lines up okay. And Dan, does that sound okay for you? I mean, that's typically how it goes, but whatever works best for your team as far as putting a date where you feel they're enrolled into system of care. What do you think?
Yeah, I've been thinking about, how do we keep that fresh in their mind, though? And just like you said, because I think last time we did this, that timing was like one of the more difficult things. Yeah, so I guess we'll discuss this with them at intake, and then as we get closer to that initial team meeting, keep on refreshing them about it, and then send that information as soon as I know that date.
Yes, and you're totally right. The sort of confusion, or the timing of this is the biggest. It can be the biggest strength and then the biggest barrier, because I think a lot of times we've now done this with so many different counties and their high fidelity wraparound teams, and I think if they find that if you go over this too early, and then you put on a date that you think the first team meeting is going to be, and then send it to us, what's happened in other places is that Ed contacts the family and they haven't had the meeting, like it had to get rescheduled for some reason, and then sometimes he doesn't even realize that happened, and he actually goes out and interviews them, and we realize that happened before the first team meeting. Or like I said, they already don't remember anything about who he is or what he's even trying to do. And so just the freshness of them knowing that this is coming and that Ed's going to talk to them. And we have a couple other things in place too. I'll show you. We have a couple of forms that you can give the families to hold on to. I'll show you those next. But you're totally right that is tricky. And, we've found it is the thing that kind of either makes or break it for him. And I don't know, Ed or Anna Maria, if you guys, I've been talking for you, but if either of you have anything to add about that process, or any tips from the other teams. I think we've sort of figured this out with most places, but it is the trickiest thing.
Yeah. Any ideas, Ed? I'm trying to think. I think you covered mostly everything on here already.
Yeah, I can't think of anything off the top of my head other than just, we only have the 30 days, and it sounds like a long period of time, at least it did to me at first, but, sometimes between my schedule and the family, who is the most important thing, being convenient for them and everything, we don't want to make them feel put out. The sooner I get it, the better, because there's always vacations and all kinds of things that can, get in the way of setting it up, and then, you can quickly run out of time. So, that's just the most critical thing that I see is the timing, if at all possible, to be, as quick as possible.
Yeah, thank you, guys. Some things that we've come up with over the years that are helping, we hope, helping to support this this process is that we give you these forms, and this is just like a cheat sheet for you guys to kind of hang on to. It just has the eligibility pieces on it. It has that middle part that says introducing the PA Care Partnership Study. That's sort of a little bit of like a script for you guys. You certainly don't have to read that, but for you to remember kind of the key points that we'd like you to say to families, to introduce them to this. Things like Delaware County is inviting you to learn about this research opportunity. You have a chance to help us learn more about services for both your family, but also families like yours. We're trying to improve our systems, and you're going to each get $20 per interview. If you agree, I can write down your name, your child's name, your phone number, the best time to reach you, and then an interviewer is going to call, and you can say, Ed McKenna, Ed's going to call to explain more about you. If you give me permission, I'm going to share it with him. It doesn't commit you to anything. You can still decide when he calls you if you wish to participate. So those are kind of like a little bit of a script for you guys to have. And then the cheat sheet about how to create the ID number is on there. And then the permission forms, it says at the bottom of the form too, but just a reminder to send them either by email or by fax, and they'll go to Anna Maria. And she logs them into our system, and she gets them out to Ed, and she's awesome at that, does it immediately. So, but they have to be logged in here. So we've had a little, we don't want them to go straight to Ed, even though you have all of Ed's contact information. It's best for them to come here to Anna Maria so she can track them. So we give you this as like a cheat sheet. And then we also give you, like, this is a little Ed McKenna brochure. Feel free to print those out or give them to families. It's just a little bit about him and who he is, his contact information, his cell phone, his email, and a picture of him, so that they're prepared for who's going to call them. And, they're comfortable with like kind of looking for that cell phone number because, it may or may not be the same area code as like in their area. So we want them to kind of not think it's a telemarketer. And, just know a little bit about who he is. So we give you this. And we also have this that you can give directly to families if you want to. Another county asked for this information, just something to hand out that tells them, this whole process is just going to take an hour, the kinds of questions that are on there. It's just, again, a little bit of an overview of what is on some of those other forms. And if you have, suggestions for how to edit this, we can also do that. If there's something that if you want this to look different for your county, this was a different county who, wanted it in this format, but, feel free to work with us to kind of find something that would be appropriate for, the families that you guys work with, so that they can have like, a couple of different things that's going to remind them that Ed's calling and who he is and what this is all about. Any like feedback about this part or questions or anything?
No, those info sheets were super helpful last time we did this. I mean, just to describe what to expect and everything.
Okay, good. That's awesome. And like I said, if there's anything about that, that you guys want to change, we're happy to edit this for you. Okay, perfect. And then just so you all know, like I mentioned before, Ed's going to go over an official consent form, and that's, if you want to see the whole consent form, we're happy to send that to you as well. I was trying not to send you 1,000 things in one email, but this is sort of what it looks like. It mentions the University of Pittsburgh on it. So sometimes that's a little bit confusing because there's a couple of different names. There's PA Care, there's University of Pittsburgh, there's Youth and Family Training Institute. So this has to be from the University of Pittsburgh. That might be confusing for people who, live all the way in Delaware County, but, just as long as you guys are familiar with all this, and if they ask you any questions like, what's this all about, that I just want you all to have enough information about what we're doing that you feel comfortable explaining it. Okay, so the volume of enrollments, and this is something, don't panic that that's how many you all have to enroll. These are the targets for the whole grant. And like I said, there's, 8 counties, and there's still actually going to be 2 more that join. So it'll be a total of 10 counties that are part of this project and splitting up all of these targets. But we're really looking for each county to enroll something, in the range of 25 to 30 families per year. And then once they're enrolled, just so you know, we continue to follow them every 6 months that they're still involved with your program until they discharge. So we're not just doing a baseline interview, we're coming back to interview them every 6 months. And this is sort of in a different format, a summary of all of the things that we're asking. So if you're curious about the questions, like I mentioned, it's sort of the referral source, system involvement, what kind of presenting issues that the youth have and that their families have, their mental health diagnosis, who is helping in the planning and treatment process, all kinds of demographics. And then the interview sort of progresses through these different types of sections, like overall health, functioning, psychological distress, which is like, feeling depressed or nervous or anxious, that kind of stuff, worried. Substance, tobacco, and alcohol use. There's questions around, these are the outcomes, but there are questions about, community-based services and how many places they've lived and where they've lived, their education, employment, crime, criminal justice, the perception of their mental health care, and social connections and what services they did receive. So it sounds like a lot, but like I said, the whole thing is still just about an hour long. And this is really the interview part. And then there's also the self-report part, which I'll show you in a second. These are just our forms. I mean, just some examples of some of the questions. You can see there the referral and system information. On the right side, those are like some of the mental health and functioning questions in case you're curious how they're formatted. And like I said, I can send you the full copies of this interview as well if you just want to look through it in case anybody asks you, why did they ask me about suicide or something? Those are some of the questions that are on this evaluation. We're certainly, very sensitive with their information. Everything is confidential. So when I show you the data dashboard programs, you're not going to be able to log in and see what each person said. Like you're not going to be able to, look at this ID number and how they answered each question, because that would be like a breach of their confidentiality. But you'll be able to see all the data like summarized by program. So you'll see your programmatic information, but in a summary format. These are the self-reports. Caregivers have 3 forms to fill out. Youth who are over 11 have 2 forms. So they both fill out the Columbia Impairment Scale. It's about 17 questions, I think, just around sort of functioning overall, their schools, family, friends, things like that. And then they both fill out the pediatric symptom checklist. It's also like sort of behavior issues, not even issues, but like behavior related questions and like attention related questions. And then caregivers fill out a caregiver strain questionnaire. So it's just about the stress that they might feel around, raising a child who has some of these like mental health concerns or other system involvement. And this is what they look like. So, you can see the questions there. There's the caregiver version of the Columbia Impairment Scale and then the youth part of the pediatric symptom checklist.
Yeah, I think the one thing, and I'm sorry, maybe you did mention this, Monica, that I always just like to emphasize, and I emphasize this to the family, is that, not only is it a voluntary interview that they can decide, at any point in time that they don't want to continue or whatever, I try to also let them know that the questions I ask, if there's any concerns, that they can choose with any question to just say they refuse to answer it. Because it is very personal stuff, and obviously sometimes people can get a little bit, feel a little bit funny talking to somebody that they just met. And, I like to let them know not only is it confidential, but even along with that, just tell me if you don't want to answer a question. I'm not going to sit here and, hit them over the head to get the answer. I'm going to just move on to the next question, and it's as simple as that.
Yeah, perfect. Thank you, Ed. That I don't think I mentioned that, so that's great. Any questions about that?
No.
All right.
No.
Okay, so this is what their payment cards look like, just so you're familiar with that as well. They each get their own separate card, and there would be $20 on each one. Like I mentioned before, they're paid for every interview that they participate in. They can take the money out, so they can either use it like a credit card and just charge that's, something that's $20 or less than that, whatever, up to $20. Or they can go to an ATM that is like a surcharge-free ATM. Usually gas stations or like service plazas have something like that, and take out the $20 and just use it as cash. Their PIN number, in case they ever get confused and not happen to mention it to you, it's 0 plus the CVV code on the back. They can also call the 1-800 number on the back and change it and set up their own PIN if they want to. So these are the cards. And they also fill out this payment form, like with Ed, whenever he does the interview, and so they get a copy of this. It has, they signed it and what the number of the card was and everything. And then at the bottom, it has the phone number of Eileen on our team, who's responsible for the payments. So that's her number there at the bottom. And then she loads them. And so if they have any problems loading the cards, you can always have them call her directly and she can kind of work it out, or they can call Ed and he can work with Eileen to, fix it. In a rare occasion, there might be something wrong with the card. Typically what happens is that people try to use the card before it's actually loaded, because the process is that Ed does the interview and he gives them the empty card and he stresses to them that they, should not use the card until he calls them back to tell them that the money is on it. And we say on there that it could be up to 2 weeks. It's usually within a day, but they can't use the card until he has a chance to tell Eileen that the interview is complete and she loads the money on the card. What we're not allowed to do is have Ed carry loaded cards around. So he's not allowed, to go out to the interview with the card already loaded, because if the family cancels or isn't there, something like that, then the card already has it's already connected with them. And if they don't end up participating, we sort of wasted the card. And unfortunately, we have to pay for these cards, so we try to minimize that. So he has to give them the unloaded card and then call them back. It's usually really fast, but sometimes people will go straight out to a ATM and try to use the card immediately, and that will make it invalid, and then he has to bring them a new card. So we stress for them not to do that, but sometimes it happens anyway, and we take care of it if it does. I'm good.
Tiffany, if you want to sit down with me and Dan at some point, we can kind of explain system of care a little bit better. For instance, your program, Transition Independence, is embedded in all of our system of care principles of youth voice and choice, intersystems collaboration, CLC, trauma-informed care. So, like Monica said, it's a philosophy of care, but I can give you more specific information if you'd like.
Okay.
Well, that was it.
And so Shannon, just so you know, and everybody else, we're going to have a bunch of new information, including some kind of posters and other information that really kind of helps define the values a little bit more in depth.
All right. So, we'll just stay in touch. That's my contact information, but, through the emails about this webinar, you all can reach me through there. If you have any questions in the meantime, we'll just look forward to kind of officially starting on the 27th, provided all goes well with the commissioners, which I'm hopeful and confident they will be. So again, thank you guys. We're excited about partnering with you, and, we're just here for you to kind of support this effort. So if you need anything, feel free to reach out, and have a great week.
Great.
Monica, thank you so much. I really appreciate you getting this pulled together so quickly. And Mark, thank you so much. And CFF, thank you for participating. We're really excited.
Yes, so are we.
Thank you.
Awesome.
All right. Thank you so much.
All right, thanks all.
Bye-bye.
Bye.
Bye.